Do you want to know more about coronavirus dashboards? How do you keep up to speed and up to date with what's happening in the ever-changing world of coronavirus? How do you know what's happening in and outside your own country? In this episode of EGP Learning, we'll be looking at various coronavirus dashboards that we've been using throughout the pandemic and a few that you might not have heard of. So buckle in and let's go.
Hi, everybody, and welcome to this episode where, as Andy mentioned, we're going to be looking at COVID dashboards and sharing with you some of the ones that are available. This is something I know you've been looking at for a while now, isn't it, Andy? Take us through it.
Yeah, so, it's one of those things I was reflecting on. I was thinking, I'm surprised we've not done an episode on this already, actually, because these dashboards are really interesting, informative, and they are quite technological. So it's a surprise that we've not done this so far, but I'm really happy that we're having a look at them today. So for those people who aren't quite sure what we're talking about in terms of a coronavirus dashboard, there's so much data out there, isn't there, Gandhi, about the spread of coronavirus in this country and in other countries, and positive tests, deaths within certain time periods of a positive test, number of people vaccinated now, that it can be difficult to make sense of all that information, place it within context, and reach conclusions about what's happening and plan what you expect might happen going forwards, make predictions, and plan an appropriate response, both on a personal and organizational and kind of governmental and international level. So people have obviously come up with various ways to try and make sense of this data, and there are multiple dashboards that take this data and try and make it accessible to us by presenting it as maps or as graphs, and these can be really interesting, informative, dare I say fun to look at if you like data visualization, but they're really good, and there's a few out there, and they all do it in slightly different ways, and I thought it would be a really good episode just to look at some of these. So shall we get cracking, Andy?
Absolutely. So I guess to help us with this, we're going to bring on some data onto the screen, and in particular we've used an article that helps us to understand a little bit more about the different kind of versions and that kind of stuff. So this is the MIT one, isn't it, Andy? I think
yes, this is an article actually from March last year, from MIT, which I think was just helping people choose from the initial crop of dashboards that were available. But we just sort of did a little search to see what people had already written about the topic, and this pointed us actually in the direction of a few that we hadn't seen already. So that's a really good article. I'd recommend that EGP learners check that out if they want to dig in a little deeper into the topic. And then there was another article that highlighted some more dashboards to us from the Nextweb. So check those articles out. So where do you think would be a good place to start in terms of dashboards, Gandhi? Where shall we begin our journey?
Well, since we're in the UK, how about we start off with the one that the government seems to be using, so gov.uk version. And this is basically the data that many people will be watching on the news every day when we get the updates and stuff. This is where it seems to come from. The kind of information that's available to you if you want to have a look at.
Yeah, so I guess what we're going to be doing over the next few minutes is looking at, we've got about 6 different dashboards that do things in slightly different ways and come from slightly different angles, and you might find it interesting to learn about them and to maybe try them out and have a look at them yourself. I've got a question for you first though, Gandhi. So this is it's the first pandemic I've really been involved in planning a response to, but it's also the first pandemic where I remember such rich data and well-presented data being available to the general public and being out there in the public domain. Do you think that's a good thing?
I think it is, because I think it helps share what is actually happening in the world. I mean, we've talked in previous episodes about fake news and that kind of stuff, and that what is nice to have is the availability of information for people to see what is actually being available and what's being reported and how significant it actually is. So I think more data is always a positive thing, and I think it also helps those people trying to innovate to try and change things to then know what to do. Because when you see kind of official data and also other sources of data, it allows you to respond so much more effectively and also innovate, I think. So I personally think it's a positive thing. I can definitely understand some of the cons being, it's a bit scary sometimes when you see some of these things, but sharing correct information, and that's the key part of it, isn't it? It's the correct information with with individuals, as far as I'm aware, is never a bad thing. It's always how they interpret it, though, is the challenge then after that point.
Yeah, absolutely. I mean, I think there's a few layers to this, isn't there? So first of all, there's obviously a lot of data that all of these sites and dashboards are pulling from. So there's an awful lot of open source data out there that individuals, universities, health services, governments can use to plan their response. So it is fantastic, the level of data sharing that's out there. I suppose if I was thinking of a downside, I think maybe, you know, if the public aren't protected from bad news, maybe they'll panic. But I don't think I've ever come across anybody who has been panicking or suffering from anxiety or adverse effects during this coronavirus pandemic that has said that they have looked at a coronavirus data dashboard and that is the thing that has pushed them over the edge. So whilst you might think that might be a problem, I don't think it.
If it is, I guess it's one that we've not seen in our clinics. I'd agree. I'm sure there are probably some people that have seen this and thought, "Oh my gosh," and panicked and definitely had anxiety from some of the spreads. And we're going to show you how some of these graphs work as well. But I think you're right; it's not a common problem, shall we say?
Yeah, and the flip side of that is sometimes you do want people to panic a little bit, and sometimes actually presenting people with this sort of data can make them make positive behavioral changes or, you know, permit the appropriate sorts of policies to be passed by their governments and so forth, which is great. And the other thing I think is good is actually it allows you to see what is happening in other countries. It allows you to see what other countries are saying is happening in your country. You know, if you're in a country where you don't necessarily trust some of the government information, perhaps, and they allow you to access websites from outside your own country. You know, you can get a second opinion on, you know, what's happening in the data, which I think is really good. So, and I suppose,
shall we have a look at this one? So this is our country's data, so gov.uk, and it's quite interesting, isn't it? Because it gives you quite a reasonable amount of depth on various different things. I mean, talk us through it, Andy.
Yeah, so I've been checking in with this dashboard throughout the pandemic, and it's actually evolved quite a lot into its current form, which I think is probably its best form, actually. So you get kind of a daily update and summary, which is essentially 4 graphs of what they believe is the most pertinent information. And I think it's really good, actually. So it gives you positive tests, the number of tests being conducted, which allows you to view that first graph within some context. We're doing many more tests now than we were back in April. Deaths within 28 days of positive tests, and the number of patients admitted to hospital, which I think are the key stats really within the UK. You can dive down deeper in terms of some of the testing data, cases, the strain on the healthcare system, and the deaths as well. And there's an interesting heat map. Shall we just go in and see what's happening in Nottingham, just to highlight the functionality here? So this looks a little worse than it did a few days ago when I was last checking in. And obviously the deeper red to purple, the color is the worst. And you can see the southeast
looking pretty grim, unfortunately.
Not faring well at all. I mean, just zooming in and looking at some of these boroughs in London. For example, I remember when when they would close an air corridor into the UK from a country where the rolling rate per 100,000 people was 80. Do you remember those days, Gandhi?
Yeah.
And now we have large portions of the country where it is in excess of 1,500. We were barring entry from countries where it was 80 over the summer. So things have really changed. And I said we'd have a look at Nottingham. So it must be up here near Leicester, Loughborough, a little higher. So Nottingham, actually, we had that period where we had a really high rate due to the student population, didn't we? But actually, that seems to have settled down. And look at this rolling rate, 180 in Nottingham. I think that's your area, isn't it? Sort of city centre, Trent Bridge, or are you more?
Centre,
yeah, that's where you are, really, isn't it? You're not quite as far as maybe Sneinton. So not too bad in Nottingham, but it's really creeping out and starting to engulf the country again.
True.
But so yeah, that's the UK map. Have you got any comments about the UK dashboard, Andy? How do you think do you find it useful?
I mean, it's short, sharp data that's UK specific, and it's pretty easy to navigate. And also, it explains the key points, which is nice. It doesn't really give much comparison with other data, which is fair enough. I mean, it's designed to show UK data, but I guess some of the ones we're now going to have a look at probably are better at looking at comparisons across different areas as well, aren't we?
Absolutely.
Shall we go to I guess the first one many people probably heard of, which is the World Health Organization one. So obviously the World Health Organization is responsible for public health across the world. And yeah, you'd imagine they'd have a pretty good dashboard. Doesn't look too bad, does it, Andy?
Yeah, so it's a good dashboard. And the World Health Organization, obviously, like is available to anyone, I guess, have a lot of data. So there's lots of different ways to visualize and explore the data on this graph. So there's obviously a fairly simple heat map, and you can hover over and see some of the key headline information about those countries. And then these are the graphs they've selected to put on the front page. So there's the global situation that you can have a look at, and then it breaks it down by continent and geographical regions. And you can see where the majority of cases are coming from, new cases at any particular point in time. And you can look back and see how things have spread over time. And then you can look at the situation country by country. So we've got the death tab highlighted. You can look at new cases, you look at deaths, and it's interesting, again, just to compare what's happening in the UK or in deaths at the moment compared to some of our neighbours like France and Italy, for example. And we do seem to be experiencing a bit more of a spike than some of these other countries that look a little bit more static, or Italy coming down from its second spike. And look at that, in the summer we were having 3 to 20 deaths per day, and now we're in excess of 1,000. So really interesting data. And then you can also look at visualize things in table form here, and there are some really I haven't even begun to explore this area, but you can obviously go very deep into the publicly available World Health Organization data. So it looks like if you know what you're doing, there's a lot of functionality there, but probably a bit of a steep learning curve from the headline map to handling some of the data. Yeah. So how do you feel about the World Health Organization one, Gandhi?
I mean, like you mentioned, Andy, you would hope that they've got probably one of the best resources in terms of depth of data, and they clearly have. They've got loads of information there that's really useful. But at the same time, it seems like it's so much data, it just seems a bit overbearing, to be honest. But actually, that's where you'd want to go, isn't it? If you want to know stuff about COVID, to be honest, it's the World Health Organization.
Absolutely. And if we were public health professionals, or working in planning and strategy at the Department of Health, then we might find this more useful than we do as day-to-day GPs. I'm going to bring up the next one. So I think Johns Hopkins University were quite quick out of the block in terms of having a usable, visually helpful dashboard, because this is the first one that I was using at the beginning of the pandemic. And actually was using it to communicate to my parents about how serious the situation was when they weren't taking things seriously at the beginning. And it's evolved a little bit over the course of the pandemic, but hasn't changed all that much. I quite like the color scheme, although it's quite alarming. And looks like a game of Pandemic or something like that. But it's quite good. Gives you headline global data. You can break down by country. You get a little breakout of the country at the side. United Kingdom data coming up. So it's not quite behaving how I expected it to at the moment. But you can break out by country. And it was really useful early in the pandemic. I think I prefer some of the other dashboards now, to the Johns Hopkins University one.
It uses the concept of dark mode, which a lot of people tend to prefer because it aesthetically looks a bit more interesting. But like you said, it's got a bit more of a ominous tone as well. But from what I hear, the data is meant to be really effective in terms of where it uses various sources for its data. And like you say, it just represents it in a nice and easy to understand. I mean, you can look at that and understand that that's where the outbreaks are and that kind of stuff. Although I tend to prefer the next one on our list, if I'm being honest, out of the two. And that's one called HealthMap, because I think it does what Johns Hopkins does, but it just looks a bit nicer. I mean, what do you think of this one?
Yes, I like this one. And the thing I like is actually, if you look at the key on the side over here, new cases. I'm not quite sure what their definition of new is, but obviously they're making the distinction between the sort of historical number of cases in an area and the new cases. So you can glance at the map and see where the majority of the new cases are occurring, which is interesting. And certain areas of Eastern Europe, UK, United States, particularly Eastern Seaboard, India, and then outbreaks in the Far East as well, in some areas of China, which is interesting because I thought they largely got that under control. So I think that's a nice visual difference of the health map. And shall we press the play button so we can see how this whole pandemic has panned out? Because I quite like this function.
Oh, go for it.
Here we go. It doesn't run for too long, but see things starting up in China and then spreading to places with major airports. You had Paris, London, Japan, and then I think it starts to go crazy. There's obviously a bit of an exponential growth in cases towards the end. And those new cases are blue, of course, as we go through.
Wow.
Nearly up to current data. And I suppose there's areas of the world where we don't have as much data as well. Certain countries, in Africa, for example.
And it's interesting, you mentioned about how the John Hopkins ones kind of looks like a game of Pandemic. A game I've been unfortunately playing a lot of lately just because it kind of feels the same kind of theme, and whether it's slightly sadistic by playing it is one called plague.inc. So it's kind of like Pandemic, but it's where you're actually playing as the virus trying to take over the world. And they've now created a new version on the app, which is the alternate one where you're trying to cure a virus. You can design the virus or however you want. And it plays, the visuals is very similar to what we just saw. It's quite interesting. I'll stick links to the app and both to the game down below in the show notes if people want to check that out. But it's one I've kind of weirdly enjoyed playing, which, they're
fun games. I mean, they were fun before the pandemic, so they're still fun now.
Particularly when you play the cure version and you beat the virus and you're like, yes, I beat COVID. Yeah.
So if you like visualizations, then the next one is very pretty, but extremely complicated. And I think has functions beyond those that are relevant for ourselves. So, so this is NextStrain. And the interesting thing about this website is you can look at the visualizations from previous pandemics. So we just thought we'd bring up the 2013 to 16 Ebola pandemic in West Africa, just to compare. It's a slightly smaller outbreak, so you can see some of the functionality of the visualization a little bit better. What this does is use publicly available genomic testing data to allow you to track the various forking and spread of new variants and new versions and mutations of the virus as they occur, and it represents that visually. It's really complicated, but actually really, really pretty. So I'm going to reset this and press play, so you can see the the vectors of travel and where the different strains of mutations are moving, which I think is really beautiful, but deadly, I guess.
Yeah.
So, and you can see how the different strains are becoming more or less numerous, and how actually less competitive strains of the virus are being replaced by new ones. I suppose this is particularly sort of interesting given the talk of the new variants of coronavirus that are of concern now. So, and let's look at the similar data for the coronavirus as well. I'm going to zoom out, press play, to see how this pans out.
Similar to the ones we just saw, the difference with this is that it's also showing the various different strains as well, like you said. So, I mean, they're going to kick off a little bit later, but as well as showing the spread and the amount of data that we saw with the HealthMap one, you'll also get to see the variants as well, which is quite useful.
So yeah, it's interesting and pretty, and obviously it's useful to some people, and actually it's useful just to be aware that viruses mutate a lot, and obviously we've got a new mutation that is causing problems in the southeast of England, but actually there are so many mutations occurring around the world. Not many of them clinically significant, but where they are, that really causes problems. So it's interesting to watch that panning out. And then we suppose we've just got one more to look at. These last few are sort of notable mentions, aren't they? So let's pause that so it doesn't cause problems in the background.
Yeah.
And then
so the last one is Woldormeter, which is one I actually quite like because it's really simple information, but then if you want, you can go into so much more depth and it presents it in such a nice and easy to use fashion. Go for it, Andy.
I was going to say, so it's having a little fiddle around. It's not maps, it's tables, which is some graphs and tables, which is useful. I need to get back to where I was before. So I had some really nice tables queued up. Here we go. So sometimes you want to ask a certain question, don't you? Or there's something that you want to know. And quite often we like to compare how our country is doing to other countries. So this just simply presents headline data and allows you to order by numbers. So you might want to say, so actually, how are we doing in terms of deaths per 1 million population, or which countries are doing particularly badly and struggling and which aren't? So we can order by deaths per, let's go the other way, per 1 million population. And it's interesting to see those countries which have been particularly badly affected. So somebody said Belgium, and I remember quite a lot of reporting earlier in the pandemic about Belgium faring particularly badly, but lots of deaths per million, and so forth. And where's the UK? So we're doing a little bit better than Italy, Czech Republic, but not quite so well as other places. And people might think, oh, the USA isn't doing a good job, but it's doing a better job than we have. Or maybe job's the wrong way to look at it, because it's not always about how good a job you're doing. It's about how unfortunate you are sometimes in terms of having large trading hubs, big global cities relative to the size of your general population and whether variants crop up and so forth. But so I think this offers something different to the map, so it's more easy to compare countries compared to some of the dashboards, which are more map based. So there we go. Yeah, so I guess those are the ones that we had lined up. Gandhi, which is your favorite dashboard?
So I'd probably go with Woldormeter and NextStrain, because I think they kind of show different types of information and they do it in such a nice way. So Woldormeter, because it's just nice and simple. You can play around with the data and have a look at the, like you say, the rates per million and that kind of stuff so easily. You don't have to go hunting around for it. And NextStrain for its visuals is just really interesting data. So I guess those are my preferences, particularly because I don't just want to know the UK stuff. I want to know how we're comparing against the other countries and things, whereas obviously the UK one is just the UK one. What about you, Andy?
So I'm going to go to the other side of the spectrum here, and I'm going to say, actually, I think the UK dashboard, I think it does a really good job in terms of my day-to-day awareness for where I live, being able to drill down and see what the situation is in my part of the world, as close as actually individual council boroughs. I think that's really, really useful. True. And to get a kind of bird's eye view of what is happening in my country, I find that really, really useful. But I take on board what you say about it being nice to know what's happening elsewhere. So hopefully people found that helpful. If people haven't been looking at these dashboards, I'd certainly recommend people give them a look. It's while some of the data is, whilst it looks worrying, looking at all of these graphs, actually knowing that you're connected with the bigger picture can actually be helpful in a way. And I think in a strange way, reduce anxiety and give you more of a feeling of, if not control, just knowing what is happening. So that's dashboards.
Absolutely. And if you do want to check them out, like we said, all the links to these dashboards will be down in the show notes below on the YouTube channel. So definitely have a look at those. If you're listening to us on a podcast as well, we'll make sure they're available for you to click on and have a look and play around with, because like you say, Andy, it's really interesting to do. We hope you found this content useful. If you have, definitely subscribe to the channel. If you're listening on the podcast or on YouTube, definitely leave us a like and a comment in terms of which was your favorite dashboard that you saw. Really like to know what people are thinking in terms of which of these is the one that they would probably look at if they had to. And I guess as always, Andy, EGP Learning is here to help save you and your patients time by taking answering primary care and learning. We'll catch you in the next episode.